So you've got to have a very patient-centric approach, but also a patience pays approach. Because this is not a field where if you're initially getting into it to make money, that's the wrong approach.
Chase, there's listeners who are curious about what path they should go, whether it's medical device or pharmaceutical, and perhaps climbing the ladder, or perhaps in the diagnostic space. Let's kind of go through a few basic questions. If a 23-year-old said, "Okay, I want to make a difference in patients' lives," what are some questions? One question that might come up. They might ask, well, "Which one can you make more money in?" What would you tell that 23-year-old who's trying to navigate that path? What would you tell that person?
Well, I think, first and foremost, before obviously you think about the dollars that can come in the industry, right? Because if you perform in whatever you do, I think dollars and monetization comes. As far as kind of process or approach, and this is the track I was fortunate to take. I think as you're cutting your teeth in healthcare, if you can really get with an enterprise that can really clinically train you on anatomy, on why providers are making decisions they are, then you can better understand how to align that product and niche that particular service, drug, device, etc., with your customer base. So, my advice to any young person looking to get into this sector is, first and foremost, I think you need to have a kind of a patient-focused heart and mindset where what you're doing is impacting someone other than yourself. You check the box there. I think you have to be willing to understand that, your schedule is really not your schedule anymore. You may be sitting hours in a waiting room waiting for 3 minutes to make an impact on a provider. And so that's where I think, especially those that might have come from a competitive background where you're used to instant gratification, this is not the world for it. Device, a little more so, because you're tracking down POs, you're in the operating room, you're seeing patients. In my case, when I was in the cardiac space, go from complete heart block to getting a pacemaker to being able to wake up and walk that next day. But in the diagnostic sector, even the drug sector, you're doing a ton of work daily, and you may not see the fruits of that labor for 3, 6, 9, even 12 months. So you've got to have a very patient-centric approach, but also a patience pays approach. Because this is not a field where if you're initially getting into it to make money, that's the wrong approach, because you're going to have to be a grinder, a gopher, a clinical specialist, an associate. I mean, you don't walk up and just get to pick up the bag and have your own sales territory and then keep climbing. Those days, unless your daddy's the founder, are done.